Today we're going to talk about chronic pain and pain habits and how your body actually can produce a habit out of your pain response, keeping you in a perpetual state of pain without moving forward. So I'm going to teach you about that as well as kind of going over ways to break that cycle, create better habits, and get rid of that pain habit. What's up, guys? Aaron Casner, Doctor of Physical Therapy. Today we're going to talk about chronic pain and specifically the pain habit that comes with chronic pain. So, what is chronic pain? Like, what's going on? Like, what's the mechanism of it? We hear about it all the time. We hear, like I've had pain for years. My doctor said I have chronic pain. I just have to live with it. Or I've been on medication for years because my pain won't go away. I'm chronic pain. So what is chronic pain? Literally, it just means that you're in pain for 6 months or longer. All right, that's the strict definition of it. Now, there's variations to it, right? It's not like you have to have pain every single day for 6 months. A lot of times it is, but you could have intermittent pain that comes and goes anytime you do a certain activity, and every time you do it, now it's been a year or two, it happens every single time. That's chronic pain as well. So, what's the pain mechanism? How does pain work? Well, first off, mind-blowing, we don't have pain receptors. There's no pain receptors in our body whatsoever. Now we have other receptors that pick up changes, but that is not picking up pain. No pain at all. So whenever you're feeling pain in your knee, it's not because a pain receptor went off and said, hey, here's pain. That's not what happens. What happens is there's a change that happens in your knee. That change is picked up by the receptors, by the nerve endings. That nerve ending sends a signal up through the spinal cord, goes up to your brain. Your brain gets that information and decides whether it needs pain or not. So if there's a big change in your knee, your brain's going to be overloaded with information and think, hey, something might seriously be wrong. I'm going to send a pain signal so then I know I can do something about it. So pain literally is the way the conscious brain and the unconscious brain communicate with each other. Like, you're not thinking about your knee until you have pain there. So pain is good because pain allows us to know that there's a change occurring in our body. But pain is no longer good if it's no longer serving a purpose. So pain without a purpose is a problem. Now that's where chronic pain comes in. There's no longer a purpose for your pain if you're in a chronic pain state. But now let's talk about habits. So how do habits form and why do we have habits? Well, habits are made so it's easier for our brain to process information at a quicker rate. So we don't have to sit there and think about things. So like take basketball, for example. So if you're learning how to shoot a basketball, you really have to think about it. You have to think about where your hands are, think about if your elbow is in a good position or not, bending your knees, how much to push off, and how much flipping your wrist you need at the end of it with your follow through. You're thinking about all those things. But do you think an NBA player is thinking about that? No, they've been doing it for so long, their brain already has a habit that's formed. It attaches to that habit whenever it needs to. Boom, everything knows what it needs to do. Habits are generally good. Another good habit would be like me driving to work. I get lost in thought and I'm thinking about random things. And next thing I know, I'm in the work parking lot ready to go inside. And I'm like, how did I get here? I hope I didn't hit anybody along the way because I sure wasn't paying attention. And you're not, because you know that if something were to change, you hear a horn, you see lights, whatever, you flip onto the conscious mode and you are now aware of what you're doing. So habits are good. We want them, but there's bad habits too, right? Like we all know of the bad habit of smoking. We shouldn't be smoking. We know it's not good for us. We know the dangers of it. But maybe we have a habit that's formed where every time we do a certain thing. So maybe every time you go and you take your dogs for a walk, you have a cigarette. So now anytime you go to walk your dogs, that habit kicks in, or, I need a cigarette. So there's a craving there and then you go for it and then you go and you smoke your cigarette. And we have to break that habit by changing things up. So pain habit is kind of similar to a smoking habit. It's a response that your brain automatically does as soon as it gets some sort of stimulus. So the stimulus for the cigarette smoking was walking the dogs. You walk the dogs, crave a cigarette, you smoke a cigarette. All right. For a pain habit, when you're having a pain response, you have a stimulus. So you have a change, let's say in your knee. So your knee changes in pressure. Your brain gets that information. It sends a pain signal. It's no longer really processing it. It's just saying, boom, right to that pain signal. As soon as you have a change, pain. Now that change may not be bad. It may be an okay change. Maybe you're starting to exercise a little more and you're loading your knee more than what you're used to. Is that a negative change? No. It can be. Now, don't go overboard. Don't go out your first day trying to do a couch to 5K and run a 5K on day one. That's not going to feel good. That's not going to be good on your body. You're going to feel pain with that. But with chronic pain, it's so much quicker. It may be as simple as putting your shoes on and walking out the front door and you have a pain response in your knee. That's not what we want. That's not desirable. That's pain without a purpose, and that's a problem. How do we break the cycle of a pain response without necessarily needing a pain response? Well, we got to give our brain new information. Our brain's on autopilot when it comes to sensation from that knee. So we need to give it new information, but not bombard it. So I'll give you a good example. When it comes to stairs. So I had a patient who was having knee pain for a really long time. So years and years. All right. She had been to the doctor. She had x-rays done, a little bit of arthritis, not really a whole lot. Like they were surprised by how little arthritis she had for her age. And they did an MRI, meniscus looked fine, ACL, all the ligaments, everything was good there. They couldn't really find anything wrong, but she was still having pain. So she had a problem. There was pain without a purpose. So she came and saw me. So we had to figure it out. There were two things that caused her pain. One of them was laying down, so like laying on her back. The other one was walking upstairs. Now she could walk miles without having any issues. She told me she used to walk her dog or she'd walk with her husband and they would walk for 3 or 4 miles, no pain at all. But as soon as she starts to walk upstairs, boom, that pain response kicks in. So every time she would do it, she had to walk upstairs. She had pain in her knee. She would stop walking up the stairs. She would peg leg it and just kind of carry it up. Or she would just say, well, I guess I'm not doing laundry right now. I'm going to go sit down. So she was creating this habit of every time she loaded her knee while doing stairs, the brain sent a pain signal and she answered it and said, okay, fine, I'm not going to do anything. The brain's getting the information saying, hey, I'm doing a good thing. I'm getting us to stop movement. I'm no longer getting sensation in that knee. Everything must be fine. But that's not what we want. We want our brain to be able to respond to it, and not in an automatic way, in a new way. So the brain has to think about it and break up that pain habit. All right? Go back to the normal habit that she had years ago of walking upstairs pain-free and just knowing how to do it. So we got to break the pain habit, get back to the old habit. How do we do that? Well, for her, what we did was we started small. Instead of doing like a normal 8-inch step height, we went down to 4 inches. So super easy, super mellow. And we had her practice that. Now, when she first started doing it, she had a little bit of pain. That pain came on. And I asked, how much pain are you having right now? She's like, it's minor, like a 1 or a 2. I'm like, okay, that's okay. We can flirt with that pain. We can go into that a little bit. So she did a couple more. And to her surprise, that pain went away because she gave her brain new information. Typically, once she had a little bit of pain, she would stop. So her brain was like, cool, we did what we're supposed to. But now she kept going a little bit, flirting with that idea. The brain got new information and was like, wait a second. I'm still getting pressure signals from here. I'm getting mechanical signals from here. But it's not going up a lot. So maybe this is okay. You keep doing it. The brain is starting to break that pain process, that pain habit. So then what do we do? Once she mastered 4 inches, we went to 6 inches. And then we went to 8 inches. And then we went to a stairwell. So what you have to do is you have to slowly build up. Like you're training for a marathon. You don't go out your first day and run a marathon. You start with walk running, and then you run a mile or two, and then you keep bumping it up. Same thing. To break that pain habit, give your brain new and safe information. Be safe with it. But don't be afraid of pain. Pain is good. Pain doesn't mean that there's necessarily an injury there. It just means there's a problem happening somewhere. Sometimes the problem is actually the body part itself, or it's the pain process. The nerve endings or the brain or something is not reacting in the way that we want it to, so we have to make those changes. Okay, so flirt with pain. Don't marry it. If you start going upstairs and the pain goes up from a 2 to a 4 to a 6, don't do that. That's just going to tell your brain that, hey, I want you to send more pain because I'm not listening to you. So listen to your brain, but also allow it to listen to you. Give it good feedback. Give it good information. So I hope that makes sense. I know it's a little complicated thinking about pain, the pain process, not having pain receptors and having a pain habit form seemingly out of nowhere. But there's always an answer for it. So if anyone tells you that pain's all in your head or just deal with it, you don't have to. There's ways to fix it. And even if you go to the doctor and they look at your knee and they say, everything's fine with this, your knee is fine, you shouldn't be having pain, go deal with it, there's still a problem there. The problem's not in your knee, it's in your pain process. So we got to figure out that pain processing system, find out where the error is, and get it fixed. Well, I hope you guys enjoyed this video talking about chronic pain and the pain habit. I got tons more videos to come about chronic pain. Chronic pain is a very, very fascinating subject. It's affecting so many people. Around 50 million people are dealing with chronic pain somewhere. A lot of it's low back, but can be anywhere in your body. So I'm going to keep teaching you guys about it. If you have any questions or want to know anything more about chronic pain, post in the comments below. Send me a message, do something, let me help you. Send me information so I can send you information. All right, click that like button, hit subscribe, help a brother out. I appreciate it. We'll see you guys.